So, good afternoon, everyone. It's really my pleasure to be here today. A very interesting forum. So, thanks for the invitation. And it's really my pleasure to moderate the upcoming session about one of most interesting topic to my heart. It's the next generation patient support programs. And when we talk about pharma, one of the hottest topics nowadays are the patient support programs. So I'm really so excited about this session and especially moderating it to one of the eminent healthcare technology leaders in Egypt and outside Egypt, Karim Khashaba, the founder and CEO of Udemy. So Karim, would you please introduce yourself more?
Thank you, Nashwa. Thank you, Omar, for having me in this forum. So I'm Karim. I'm the CEO and founder of Udemy. I'm a computer scientist by education. After my computer science studies and studying and working for a couple of years, I decided to switch careers and move to management consulting. So I joined Booz and Company initially in Munich for a few years and then Dubai. And then since 2016, I've been in Egypt pretty much focusing on the family business, and then later kind of started Udemy, which is a pharma platform basically that connects pharmacies, insurance companies, and obviously offers the consumers a much easier way to order and use their insurance card.
Yeah, very impressive. Thank you, Karim. So let's start. Patient support program, and why I'm saying that it's one of the most interesting topics to me because like over the last 10 years I have been managing the PSP for different multinational pharmaceutical companies, so I was so close to the changes happened in this market or in this field for the patient support program. I also touched the importance of patient support programs to the patients, to all the stakeholders, as well as to the pharma companies. And this is what we want Karim to get more insight about this, because the pharma can win strategically and commercially by designing a robust patient support program that can or include the success or the secret of the success for such a program. That's what we need to learn more about. So if I talk about 10 years back, the patient support program as a concept used to be the patient affordability programs or the patient access programs, what the companies can do for patients to enhance or facilitate getting the medications or getting it with different prices or access models. And this sometimes it's company initiatives and sometimes it's regulatory requirements that the company has to do, to implement it and to control it as well, because PSP, as we all know, one of the most sensitive in terms of compliance as well, especially for pharmaceutical industry. So it has to be very well controlled. And after that, we started to hear different patient support programs strategies and the designs, which is customizing some services around the patient needs. But still, it's around the medication, the disease area, or in terms of different. I mean, according to the therapy area, to the patient, to as well the budget that the pharmaceutical company wants to spend in this regard. And Karim, if I was just reading an article by Fierce Pharma that was published 2 months ago, and it said that patient support programs nowadays are one of the most or the highest area of spend for pharmaceutical companies. So in average, multinational companies spend around $5 billion annually for patient support programs. However, it also mentioned that only 5% of the targeted patients get benefit from these PSP. And this was a little bit I mean, we were chatting about this topic, and I want to hear from you your point of view for this. Why it's so important? Why it's pharma now are willing to invest more in this area? And why only 5% of patients are able to get the benefit of patient support program? So the floor is yours.
Thank you for the intro, Nashwa. So first, maybe a first caveat, bear in mind it's a computer scientist looking at patient support programs. So I can only kind of give you the assessment from my vantage point, and give you maybe the kind of the impression I got from the interactions we've had with pharma companies over the last 2 years here in Egypt, more specifically. I don't actually have experience outside of Egypt on this topic specifically. So, is there a need for patient support program? Absolutely. So, if you look at a country like Egypt, where out-of-pocket spend on healthcare is more than 60%, right? Means people are pretty much paying themselves for healthcare. It makes sense, right? Either you have an insurance card, or you have some form of program that's covering your medical expenses, or you don't. And if you don't, you can either afford your treatment, or again you don't. And I think there's a very big segment here in Egypt that needs affordable access to medications, that otherwise they would not be able to get access to. And that's kind of the very simple reasoning as to why these programs have to exist.
Yeah.
Now, the need is there. I believe the execution from the pharma companies to this day is still at kind of the first level. Let me put it this way. I think generally it was approached either as at least you can see it was built up over time as a quick marketing initiative, or a quick kind of project-based, team-based initiative, as opposed to more of a holistic company strategy, more of a platform approach.
Yeah.
And so, if you ask me, the problem set itself already exists in other industries. It's just that the pharma companies, I think, to this day are still approaching it in a different way. And more
Yeah.
specifically, for patients to be able to access medications and get subsidies on these medications, or any kind of financial support, is already a problem that was solved by insurance companies. And so pharma
Yeah.
companies really don't need to reinvent the wheel there. There's a network of medical providers, whether it's kind of pharmacies or investigation centers, lab and radiology, that offer services to a specific subset of patients at a discounted price, at a subsidized price, or whatever. And there's some form of financial reconciliation with whoever the payer is. Could be a pharma company, could be someone else. And so really kind of this process infrastructure has already actually exists in Egypt in many for insurance companies. And it's one of the things that Udeo is actually doing for insurance companies at the moment. Instead of the pharma company having to go and agree with a certain population of doctors to enroll the patients, or give them some form of token or identifier to be able to enroll, and then go contract a third-party teleconsultation or a call center service that the patient needs to call, and then go to a network of medical providers in order for the patient to get the service, and agree on some reconciliation process by which the patient gets some discount that the medical provider is able to claim later. All of this can be connected into one digital platform, where basically you have a platform like Udeo, or like any other kind of digital startup in the ecosystem, that can connect pharmacies, can connect doctors, can connect the patient himself, and has the back office capabilities to carry out complicated calls at scale, that can follow inclusion criteria and apply them on behalf of pharma companies. And so in my view, kind of we can take and almost replicate all the know-how, all the process infrastructure of insurance companies, and apply it to patient support programs. And what is left there is then the personalized communication that comes on top, which I will dare say, and maybe a lot of people will not be happy with me, but based on the programs that I've seen so far, it's a lot of the kind of communication plans that are attached to patient support programs are just either too irrelevant, too big, not personalized for the patient himself, end up being a little bit mechanical, a little bit irrelevant. You feel like a call center agent has to deliver or read out a message. It's not. It's not, in my view, fitting of something that's happening in 2021, almost 2022 now. So a lot of the content, in my view, can be delivered through digital. You can send people YouTube links and they can watch whatever they want or they don't watch. So a lot of the delivery itself of these communication plans is also suboptimal, but the content itself needs to be a lot more precise, a lot lighter for the ordinary person to be able to digest. Yeah, that's kind of my first kind of view on PSPs.
Yeah, so it's great. I believe that you mentioned the success ingredient to a successful PSP, which is personalization. So the ecosystem or the platform can be developed at a very high standards. However, if it's if it's not customized or personalized to fit the patient needs, and here I can say it, if as you mentioned that we're looking for beyond 2021 healthcare system or healthcare ecosystem that is looked to patients as consumer, and we are talking about consumerism and the patient satisfaction, and it has to fit the patient life, not just the patient need related to this medication or this kind of or disease. So it's you perfectly summarize it into personalization, personalized communication, and personalized design of the program to fit the needs. So how the technology can enable, as enabler, I mean this would never happen if there is no technology. But in the digital health era and the technology, how can this be personalized to patients? If I have a program with 10 patients, so each and every patient has his own program delivered to or his own value. So how can the technology help or enable this?
I think that's a complicated question. I'll tell you honestly my view on personalization, and not to be a pessimist, but I think very often kind of the first step towards a digital program is a very simple MVP or minimum viable product, right? And if you try to personalize or add too many features, typically these programs kind of fail, and we've seen so many kind of fail in the process just because someone wants to come in with a big promise, or they want to change the world in 3 months, or kind of these, and a very typical kind of corporate pitfall in my view. I think at this stage, personalization is important just by giving people choice. Really, if you send me as simple as 10 different YouTube videos and I just watch the one I like, that's already personalization enough, as opposed to having a call center agent read out 7 minutes worth of guidelines, right? It's I think the key here is really to start very simple, start at the basics, right? And I think instead of kind of going for keywords like AI or I don't know, deep learning, or just the stuff that people say without actually any practical kind of software development implications. And I would, at this stage, I think at this stage, when it comes to PSP and digital, we're still in the infrastructure stage. So it's not exactly about how we engage the patient. It's about how are we connected to the medical providers? How do we ensure that there's no fraud or abuse in a country like Egypt? So it's much more fundamental questions, I would say infrastructure, rather than having some artificial intelligence that's talking to the patient, right? That's not where we are. That's not where the industry is. That's not even where the technology is at the moment. And so again, I think the key is to start very simple, not to overload these programs with complicated requirements, and just focus on the most basic version of the process working very well.
Okay. Yeah. Yeah, it makes a lot of sense. So sometimes we are overwhelmed by the technology, the complicated technology to show that the advancement of programs or something, but we forget the basics that are essential for the program success. Thank you, Karim. And so if I ask you, how do you see the next generation patient support program, the future? I mean, yes, we know that Egypt and our region is still lagging behind a little bit. But if we talk about the global pharma as a sponsor, but it can be initiated by anyone. So how do you see the next generation patient support program globally?
I think that's a difficult question to answer, but for starters, I think the starting point is how patients enroll in patient support programs, right? That's the point of failure in many programs. Who qualifies? How do you verify that they do actually qualify? And just having a better cooperation framework with medical providers for enrollment. I think this is really the first step in the chain that has to be fixed. And I would argue it starts at digitizing medical records. So instead of uh, patients basically being told in the doctor's office they qualify for enrollment, would you like to enroll, would you do this? There is some automatic detection for who enrolls, just aggregating databases of medical providers together with maybe public databases and having some kind of automated approach towards enrolling patients to patient support programs. And I think this will increase the numbers significantly. You'll be able to choose the patient, not be subjected to basically people coming in to request to enroll. I think that's a kind of a dramatic shift. I would argue possibly already happening somewhere else in the world. Again, I only have Egypt as a data point. So that's one. Two, I think the engagement interface in general will obviously go digital. Instead of having to receive any kind of call, instead of you'll be able to chat, you'll be able to get maybe a landing page that is personalized to you, that has all the content that you care about. Medication delivery services will flourish everywhere in the world. You'll not have to go to a pharmacy. You'll not have to go at least like here in Egypt, exchange boxes and so on. So all of this
Yeah,
will be completely streamlined, and the patient will basically be enrolled while he is at home
yeah.
and get his stuff at home, and everything will be seamless. That's really how I see kind of the customer journey. Even the home labs and all of this can be delivered at home if economic for the patient. So it's a very big combination between home care services in general and just having a solid infrastructure for financial reconciliation with the medical providers. Not being limited to a specific medical provider is also very, very important. To be completely open, democratized, so a platform where, regardless of where you go, you will be identified and you will be given the opportunity to enroll.
Yeah, yeah, this is very important, Karim. And you mentioned the digitalization of medical records. And I believe that this is a very important point to tackle because digitalization of the medical records is it's EMR or EHR are the mains or very important source for health informatics. And for patient support programs in specific, usually, or what I saw from my experience, that we ignore a very important part, which are the data or the analytics. So we don't look to the data that's aggregated from the patient support program and how to build and utilize it, how to improve the patient support programs based on the collected data. Although by definition it is the PSP is a systemized data collection platform. So how do you see the pharma can get benefits or strategically even from the data collected from the PSP, how it should be collected in order to have insights from these data throughout the program?
No, look, it's quite simple. At this stage, there are emerging standards for medical data. Something like FHIR or HL7 already lays a foundation for how medical data can be structured and transferred. And so pharma companies can build incredible analytics around the data that's being fed by PSP programs, whether they use it directly to in product research or they're using it just simply to improve their access strategies for patients. There's a lot that they can do. It ultimately depends on obviously the quality of the team working on that. So they will need to have big data or data analytics divisions in the future, that's for sure. And pharma companies also have, I think, a big advantage that they have leverage with medical providers. They can play a role in pushing digitization of medical records. Historically, it's not something that they have been doing, but I think it's also one of these areas where they can help a lot. They have the access to doctors. They can create incentive programs for doctors to digitize medical records. There's a lot that can be done.
Yeah. Yeah, thank you, Karim. And I believe that by this, we reached to the end of our session. I really enjoyed the discussion and your perspective for things. It's really very important. Patient support program, one of the hottest topics in the pharma industry. As Karim mentioned, now we see different types of patient support programs. Yes, we have to think of the basics, but we see patient access programs that include named patient program or financial assistance program. We see patient adherence or to improve the adherence, such as different loyalty programs and patient education. We see patient convenience programs that focus on something around the patient satisfaction and the quality of life for patients. Usually we call it beyond the bill, and this is how the pharma is thinking of when they design PSP. Otherwise, it can be called a patient access program, not just a patient support program. And the secret ingredients, as Karim mentioned, in developing a successful patient support program is the personalization. So now, regardless of the technology or the digital tools that we use, now we sometimes that we think of something and we receive the ads on Facebook based on what we think or what we talk with others on it. It's the same. So how we can utilize to reach out to the correct or the correct individuals with the correct message or the right message for them and the right service for them. So one size fit all, it's no more the standard in healthcare, especially post COVID or after the COVID era. We see the engagement. So now there is a shift in the power in the healthcare from HCP to patients. Patients now are informed, are engaged. They go to the doctors while they have like 80% of the information in their mind. They challenge the medication, the everything. So patient engagements become mandatory. This become a cornerstone for building patient engagement or integrated patient solution, if we call it, as a next generation PSP has to be integrated solutions for patient engagement around the disease or around any need in their life. It's also very important, and from what I saw from my experience in pharma, especially over the last 6 years, that pharma company can win strategically and commercially, and even PSP can be a competitive advantage for certain company if it's designed and the correct strategy is put in place. So again, it has to be personalized. It has to touch a real need or touch points in the patient journey that makes the most of the difference or the benefit for patients. And it's not just what we are talking about when during our meetings or our brand team discussion, but it's what the patient needs, and it's different from country to country. It's different from disease area to disease area. So this is very important to be taken into consideration in designing a correct PSP strategy, whoever the leading it is, marketing, medical affair, or whatever. And the last thing, which is the data, because data, as we hear these days, is the currency of healthcare or the future healthcare currency. So how to utilize data? Without data, we don't have anything. I mean, we don't have, we cannot establish anything correctly, either in the healthcare or outside. Yes, we are lagging behind this stage. However, we have to think how we will utilize these data, how we can, the PSP is to be a dynamic process for continuous improvement and enhancing based on KPI and analytics from the data collected, and definitely for the compliance part. I can see that the next generation PSP, it will be still personalized, data driven. It's grounded by behavioral science, AI, whatever, but it has to be personalized. It has to combine different services around the patient life and the patient journey itself. It will be a predictive, adaptive to the patient needs, and fitting into the whole patient life. So by this, Karim, if you have anything to add, please go ahead.
No, thank you very much. It was a real pleasure talking to you, Nashwa. And well, I look forward to working with more people who are keen to advance the topic. And thank you very much for having me.
Thank you. Thank you, Karim. Thank you for the organizers for inviting us. And thanks, everyone, for listening. Thank you.
Thank you.